So looking at the large models here, kind of in the middle of the abdominal cavity again, are arteries and veins. So right up top here, so this is our celiac trunk right here on top of the descending aorta. Immediately below that is the superior mesenteric artery. Okay, we can see our renal arteries and veins right here. Branching off of that is the adrenal vein. You can see, so this is the spleen over here. So we can see our splenic arteries and veins there. This branch that comes down along the sides here and kind of makes these braided patterns a little bit. Those are my gonadal arteries and veins. Okay, this next lump down here, this is my inferior mesenteric artery. So just above the inferior mesenteric artery, kind of behind it over here, we can find our lumbar arteries and veins. You can see my common iliac artery and vein, the internal iliac artery and vein, making this the external iliac artery and vein. Okay, so now we're looking at the internal, the abdominal cavity. So your inferior vena cava is the large one here. The descending aorta is the large one, really adjacent to it. So starting up here at the top, we can see the hepatic going to the liver, arteries and veins. See the gastric going towards the stomach, arteries and veins. The splenic going over here to the spleen, artery and vein. The renal arteries and veins go into the kidneys. So we find the renal vein here. Immediately above it and immediately below it is the superior and inferior mesenteric arteries and veins. The aorta and the vena cava branch down here at the bottom, and these branch to form the external iliac arteries and veins, and then branching off of the external iliac artery and vein is the internal iliac arteries and veins. And finally, this little section down here below the branch is the median sacral artery. Okay, so now we're looking at a kidney here. So the kidney's got a lot of arteries and veins in it that we need to know. So of course our renal artery and vein are right here. The renal artery comes in and branches to form into the segmental artery right here. It's going to branch again, which brings us to the lobular artery, which is finally going to branch again into the interlobular artery. From there it wraps around into the outside region of the kidney here. And this is the arcuate artery. And then from the arcuate you have these little branches that flow up into this region of the kidney. This region is called the cortical region, so that makes these our cortical radiate arteries. Okay, so like I just said, from about here, from the top of your renal pyramids, which are these structures here, from about there up is the cortical region. From there down is the medullary region. Okay, so coming back over here, so we've got our ureter. Okay, so the ureter, where it enters into the kidney, or more like where it leaves the kidney, you've got the renal pelvis. The renal pelvis has branches that come off of it. Right here will be our major calyx, which branches to these smaller versions here, which are their minor calyx, and those connect directly to our renal pyramids. The renal columns separating the individual renal pyramids, and then the renal capsule, which is the darker region on the outside here that completely surrounds the kidney itself. Okay, so now we're looking more zoomed in from the kidney in this particular video. So this is our renal pyramid. So this will be the medullary region. in the cortical region. You can see way up here on top would be that renal capsule. Okay, so here is the cortical radiate artery that we talked about in another video. The individual white sacs that you're seeing here are the renal corpuscles. Inside the renal corpuscle is the glomerulus. Glomerulus drains into the proximal convoluted tubules. It's the squiggly part here. Then the loop of Henle comes down into the renal pyramid, comes back out to the distal convoluted tubules, which all drain into the collecting duct. Okay, so we're looking at a renal corpuscle here. So this is our renal corpuscle from here down. Juxtaglomerular apparatus is the part on top of it. Okay, so in the juxtaglomerular apparatus, you have this structure up here was the distal convoluted tubule, surrounded by the macula densa cells. You have an afferent arteriola with JG cells there. That comes into all this squiggly stuff here. That's the glomerulus itself. The podocytes are these structures here. They have their filtration slits in them. The empty space between the Bowman's capsule and the glomerulus is the glomerular space. We can see down here, this is the proximal convoluted tubule, which has that cuboidal, simple cuboidal epithelium, simple squamous epithelium. And then going out the other side here is the efferent arteriole.